Right now, at this very moment, millions of Americans over 60 are suffering from chronic back pain. And here's what's terrifying. Most of them have no idea that this pain isn't just about getting older. It's actually a red flag that one critical mineral is dangerously low in their body. And if you ignore it, you could be weeks away from permanent spine damage that no surgery can fix. I'm not trying to scare you. I'm trying to save you from what happened to 68-year-old Margaret from Ohio, who went from gardening every day to being unable to stand for more than 10 minutes, all because she didn't know about this one mineral deficiency. But here's the good news. It's not too late for you. Hello, friends. If you're over 60 or if you're caring for someone who is, stay with me for the next few minutes. What I'm about to share could literally change your life or save you from years of unnecessary suffering. Back pain isn't just an inconvenience. It's not just part of getting old. And it's definitely not something you should just learn to live with. According to the National Institute of Health, over 80% of Americans will experience significant back pain at some point in their lives. But for those over 60, the stakes are much, much higher. Why? Because when you're older, back pain often signals something deeper, something that's silently weakening your spine, your bones, and your ability to live independently. And the shocking truth, this entire cascade of problems often comes down to one single mineral that most seniors are desperately lacking. Today, we're going to talk about magnesium. Yes, that's right, magnesium, and why this overlooked mineral might be the difference between enjoying your golden years pain-free or struggling with chronic back pain that steals your independence. Let me ask you something. When was the last time you had your magnesium levels checked? If you're like most people over 60, the answer is probably never. And that's exactly the problem. Here's what most doctors won't tell you. Nearly 50% of Americans are deficient in magnesium, and that number jumps even higher for seniors. Why? Because as we age, our bodies become less efficient at absorbing this crucial mineral from food. Plus, many common medications that seniors take, diuretics for high blood pressure, proton pump inhibitors for acid reflux, even some diabetes medications, they're all quietly draining your magnesium reserves. Now, you might be thinking, but I take calcium for my bones. Isn't that enough? And I'm so glad you asked, because this is where things get really interesting and a bit alarming. Calcium and magnesium work together like partners in a dance. Calcium hardens and strengthens your bones, but magnesium is what helps your body actually use that calcium properly. Without enough magnesium, all that calcium you're taking, it doesn't go where it should. Instead of strengthening your spine, it can actually deposit in your soft tissues, your joints, even your arteries. This is why some people take calcium supplements religiously and still end up with osteoporosis and terrible back pain. Think about your spine for a moment. It's not just one bone. It's 33 individual vertebrae, held together by muscles, ligaments, and cushioned by discs. Every single day, your spine supports your entire body weight, bends, twists, and absorbs shock. And magnesium is absolutely essential for keeping all of those components healthy and functioning. Let me explain this in a way that makes sense. Magnesium does 4 critical things for your back and spine. First, it keeps your bones strong and dense. About 60% of the magnesium in your body is stored in your bones. It works alongside calcium and vitamin D to maintain bone density. When you're deficient, your vertebrae, those stacked bones in your spine, become brittle and prone to compression fractures. These are tiny cracks that happen especially in the lower back, and they're incredibly painful. Many seniors don't even know they have them until the pain becomes unbearable. Second, magnesium relaxes your muscles. Have you ever experienced those terrible back spasms that seem to come out of nowhere? Or maybe you wake up in the morning with your lower back so stiff and tight that it takes you half an hour just to straighten up. That's often low magnesium. This mineral acts like a natural muscle relaxant. When you don't have enough, your back muscles stay contracted, tight, and painful. It's like they're clenched in a fist that never opens. Third, magnesium fights inflammation. Chronic inflammation is one of the main drivers of back pain, especially as we age. it causes swelling around your spinal discs and nerves, leading to that deep, aching pain that never quite goes away. Magnesium has powerful anti-inflammatory properties that help calm this inflammation before it causes permanent damage. And fourth, this one's crucial, magnesium protects your spinal discs. Those rubbery cushions between your vertebrae need water to stay plump and healthy. Magnesium helps regulate fluid balance in your body, keeping your discs hydrated and shock absorbent. Without it, those discs dry out, flatten, and eventually herniate or bulge, pressing on nerves and causing that shooting pain down your legs that so many seniors suffer from. Are you starting to see how important this one mineral really is? Now here's what I need you to pay very close attention to. Magnesium deficiency doesn't announce itself with a big dramatic symptom. It creeps up slowly, disguising itself as normal aging. But there are warning signs, and if you're experiencing several of these, your back pain might be screaming for magnesium. Warning sign. Number 1. Chronic lower back pain that's worse in the morning. If you wake up feeling like you've been hit by a truck and your back is stiff and painful until you've been moving around for a while, that's a classic sign. Your muscles have been contracted all night because there's not enough magnesium to help them relax. Warning. Sign number 2. Frequent muscle cramps and spasms. Do you get Charlie horses in your calves at night? Do your back muscles suddenly seize up when you bend over or twist? Muscle cramps are one of the earliest and most common signs of magnesium deficiency. And if it's happening in your legs, it's definitely happening in your back too. Warning sign number 3. Persistent fatigue and weakness. Magnesium is essential for energy production in every cell of your body. When you're deficient, you feel tired all the time, even after a full night's sleep. And when your muscles are weak, your back has to work even harder to support you, leading to more pain and strain. Warning. Sign number 4, numbness or tingling in your extremities. Many seniors dismiss this as just part of getting older, but numbness and tingling, especially in your hands and feet, can indicate that your nervous system isn't getting the magnesium it needs. And remember, your spinal cord is part of that nervous system. Warning sign number 5, difficulty sleeping. Magnesium helps regulate your sleep-wake cycle. If you're tossing and turning all night, if you can't get comfortable, if your mind races and your body won't relax, low magnesium could be the culprit. And poor sleep makes back pain worse, creating a vicious cycle. Warning sign number 6, bone pain and increasing fractures. If you've had a fracture from a minor fall, or if you're developing a stooped posture, what doctors call kyphosis, these are red flags that your bone density is dropping. And magnesium deficiency is often a hidden factor. If you're experiencing 3 or more of these warning signs along with back pain, please don't ignore it. Your body is trying to tell you something important. Before we continue, let me say this. If you're over 60, or if you're caring for an elderly loved one, this information could genuinely be life-changing. I've seen too many seniors suffer needlessly, popping pain pills that only mask the problem while their spine continues to deteriorate. If this video is resonating with you, please do me a favor. Hit that like button right now and make sure you're subscribed with notifications turned on. We share crucial health information for seniors every week, information that your doctor might not have time to explain in a 15-minute appointment. Your health is worth it. Now you might be wondering, why is this such a big problem for people over 60? Great question, and the answer explains so much. As we age, several things happen that make magnesium deficiency almost inevitable if we're not intentional about preventing it. First, absorption decreases. Your digestive system doesn't work the way it did when you were 30 or 40. The lining of your intestines changes, and you produce less stomach acid. Both of these factors make it harder to absorb magnesium from the food you eat. You could be eating a magnesium-rich diet and still not getting enough into your bloodstream. Second, kidney function declines. Your kidneys are responsible for regulating how much magnesium stays in your body and how much is excreted in urine. As kidney function naturally decreases with age, this regulation can go haywire, and you end up losing more magnesium than you should, Third, medications rob you of magnesium. This is huge, folks. If you're taking diuretics, water pills for blood pressure or fluid retention, you're literally flushing magnesium out of your body every single day. Proton pump inhibitors, like omeprazole, which so many seniors take for heartburn, interfere with magnesium absorption. Some antibiotics, diabetes medications, and even laxatives can deplete your magnesium levels, and most doctors never mention this side effect. Fourth, chronic conditions increase your needs. If you have diabetes, digestive disorders, or any kind of chronic inflammation, your body uses up magnesium faster than normal, trying to cope with these conditions. It's like having a leak in your gas tank. You need to fill up more often just to keep going. And fifth, diet changes. Many seniors eat less as they age, or they shift to softer, processed foods that are easier to chew and digest. Unfortunately, these foods are often stripped of magnesium and other vital nutrients. The foods richest in magnesium, leafy greens, nuts, seeds, whole grains, are often the very foods that seniors eat less of. When you add all of these factors together, you can see why magnesium deficiency is practically an epidemic among older adults, and why your back pain might be a desperate cry for this essential mineral. Let me share something fascinating from the research that really drives this home. A groundbreaking study published in the Journal of Osteoporosis followed over 2,000 adults aged 60 and older for 5 years. What they found was remarkable. Those with the lowest magnesium levels had significantly higher rates of vertebral fractures and chronic back pain compared to those with adequate magnesium. But here's the kicker. When researchers gave magnesium supplements to the deficient group for just 6 months, they saw measurable improvements in bone density and significant reductions in pain levels. Another study from the American Journal of Clinical Nutrition found that magnesium supplementation reduced inflammatory markers throughout the body, including in the spinal tissues. Participants reported less pain, better mobility, and improved quality of life. And perhaps most importantly, research from the National Institutes of Health has shown that magnesium deficiency contributes to something called neuromuscular irritability. Basically, your nerves and muscles become overexcited and hypersensitive. This is why deficient people experience more pain from the same amount of damage. Their pain threshold drops and everything hurts more intensely. Think about that for a moment. You might not have more back damage than someone else. You might just be feeling it more acutely because your nervous system is starving for magnesium. All right, now for the part you've been waiting for. What can you actually do about this? How do you restore your magnesium levels and start protecting your spine? Step 1. Talk to your doctor about testing. This is crucial, folks. Don't just start taking supplements without knowing where you stand. Ask for a magnesium RBC test. That's red blood cell magnesium, not the standard serum test. The RBC test is much more accurate for detecting deficiency. If your doctor says testing isn't necessary, politely insist or seek a second opinion. You deserve to know. Step 2. Increase magnesium-rich foods in your diet. This should always be your first line of defense. Food provides magnesium in a form your body recognizes and uses efficiently, plus you get all the other nutrients that come with it. The best food sources include dark leafy greens like spinach and Swiss chard. Just 1 cup of cooked spinach gives you about 160 milligrams of magnesium. Pumpkin seeds are absolute magnesium powerhouses. Just an ounce provides nearly half your daily needs. Almonds, cashews, and Brazil nuts are excellent choices. Black beans, kidney beans, and edamame are great options if you can digest them well. Whole grains like brown rice and quinoa, and even dark chocolate, yes, dark chocolate with at least 70% cacao, is a legitimate magnesium source. If you have trouble chewing nuts or raw vegetables, try nut butters, smoothies with spinach blended in, or well-cooked greens. Get creative and find ways that work for your lifestyle. Step 3. Consider a high-quality magnesium supplement. Now here's where it gets a little tricky, because not all magnesium supplements are created equal. There are several types, and some are much better absorbed than others. Magnesium glycinate is my top recommendation for most seniors. It's gentle on the stomach, highly absorbable, and doesn't cause the digestive upset that some other forms do. It's especially good if you have back pain because the glycine component itself has calming properties that help with muscle tension. Magnesium malate is another excellent choice, particularly if you have fibromyalgia along with your back pain. It combines magnesium with malic acid, which supports energy production and may help reduce muscle pain. Magnesium citrate is well absorbed but has a laxative effect, so it's best if you tend toward constipation. Just start with a low dose and work your way up. Avoid magnesium oxide if possible. It's the cheapest form, which is why it's so common in drugstore supplements, but it's poorly absorbed and most of it ends up going straight through you without helping. The recommended daily amount for men over 60 is about 420 milligrams, and for women it's 320 milligrams. But if you're deficient, your doctor might recommend more initially to build your levels back up. Never take more than the recommended dose without medical supervision, especially if you have kidney problems. Step 4. Enhance absorption. Take your magnesium supplement with food to improve absorption and reduce any stomach upset. Make sure you're also getting adequate vitamin D because these two nutrients work together, and spread your dose throughout the day. Your body absorbs smaller amounts better than one large dose. Step 5. Address medication interactions. If you're on any prescription medications, especially those I mentioned earlier, talk to your doctor about timing. Some medications should be taken at different times than your magnesium supplement to avoid interactions. Never stop taking prescription medications without medical guidance, but do advocate for yourself and ask about alternatives if your medications are severely depleting your magnesium. Step 6. Support your spine with other healthy habits. While you're building up your magnesium levels, and this is important, don't neglect the other pillars of spine health. Stay as active as you safely can. Gentle exercises like walking, swimming, or chair yoga help keep your back muscles strong and your spine flexible. Maintain a healthy weight to reduce stress on your spine. Practice good posture even when sitting. Your mother was right about that one. And stay hydrated because those spinal discs need water just like your cells need magnesium. Now I want to set realistic expectations because I care about you and I don't want you to feel discouraged. Increasing your magnesium levels doesn't happen overnight. Your body has been running on empty for possibly months or even years, so it's going to take time to refill those reserves and start seeing improvements. Most people start noticing some changes within 2 to 3 weeks. Maybe you'll sleep a little better, or those muscle cramps start to ease up. But real, significant improvements in bone density and chronic back pain typically take 3 to 6 months of consistent supplementation and dietary changes. That might sound like a long time, but think about it this way. You've probably been dealing with this pain for months or years already. What's a few more months if it means finally getting relief that lasts, relief that addresses the root cause instead of just masking symptoms? Mark your calendar, keep a simple pain journal, and track your progress. You might be surprised at how much better you feel when you look back after a month or two. Before we wrap up, I need to be very clear about something. While magnesium deficiency is incredibly common and often overlooked, it's not the only possible cause of back pain. There are situations where you need to see a doctor right away, and I don't want anyone delaying necessary medical care. Seek immediate medical attention if you experience any of the following. Back pain accompanied by loss of bladder or bowel control. This could indicate a serious condition called cauda equina syndrome that requires emergency treatment. Severe back pain after a fall or injury, especially if you have osteoporosis. Back pain with unexplained fever. This could signal an infection. Progressive weakness in your legs or difficulty walking. Pain that radiates down both legs or causes severe numbness. Back pain with unexplained weight loss. Any new or severe back pain if you have a history of cancer. These symptoms could indicate serious conditions that need immediate evaluation. Magnesium is wonderful, but it's not a cure-all, and your safety comes first. For most chronic aching back pain without these red flag symptoms, addressing magnesium deficiency while working with your healthcare provider is a smart, safe approach. I want to leave you with some hope by sharing what I've seen firsthand. Remember Margaret, who I mentioned at the beginning? After her magnesium levels were tested and found to be critically low, she started supplementing with magnesium glycinate and increased her intake of leafy greens and nuts. Within 3 months, she reported that her chronic lower back pain had decreased by about 60%. She was sleeping through the night again. And after 6 months, she was back in her garden doing what she loved. Then there's Robert, a 72-year-old retired teacher who came to me hunched over, barely able to walk a city block without debilitating back pain. His medication list included a diuretic and a PPI, both magnesium-depleting drugs that no one had warned him about. Once we addressed his deficiency and worked with his doctor to adjust his medications where possible, his transformation was remarkable. He's now walking 2 miles a day and recently took his grandchildren to a baseball game, something he couldn't have imagined doing a year ago. These aren't miracle stories. These are real people who were suffering unnecessarily because one crucial piece of the puzzle was missing. Could you be next? Could addressing this one mineral deficiency be the turning point in your battle with back pain? Friends, let's bring this all together. Your back pain isn't just something you have to live with. It's not an inevitable part of aging that you should just accept. Yes, our bodies change as we get older. That's natural. But suffering isn't natural. Being unable to do the things you love isn't natural. If there's one thing I want you to take away from this video, it's this: magnesium matters. This humble mineral plays an absolutely critical role in keeping your spine strong, your muscles relaxed, your inflammation under control, and your bones dense. And most people over 60 aren't getting nearly enough of it. But here's the beautiful truth. This is something you have the power to change. With simple dietary adjustments, appropriate supplementation, and guidance from your healthcare provider, you can replenish your magnesium levels and give your spine the support it desperately needs. You deserve to wake up without pain. You deserve to play with your grandchildren, tend your garden, take that trip you've been dreaming about, or simply stand at the kitchen counter making dinner without your back screaming at you. Don't let another week go by ignoring this problem. Take action today. Talk to your doctor. Get tested. Start adding more magnesium-rich foods to your meals. Your future self, the one who's living pain-free and active, will thank you for making this decision right now. If this video opened your eyes to something you didn't know before, I want to ask you for a few small favors. First, please subscribe to this channel and click that bell icon so you don't miss our future videos. We're dedicated to bringing you practical, research-based health information specifically for seniors, the kind of information that can truly change your life. Second, share this video with someone you care about. Maybe it's your spouse, a friend from church, a neighbor who's always complaining about their back, or your own parents. Back pain affects millions of seniors, and most of them have no idea about the magnesium connection. You could literally change someone's life by sharing this information. Third, leave me a comment below. Tell me, are you dealing with chronic back pain? Have you ever had your magnesium levels checked? Or maybe you've already tried magnesium supplementation? If so, I'd love to hear about your experience. Your story might be exactly what another viewer needs to hear to take action. And finally, take care of yourself. You matter. Your health matters. And you have more control over it than you might think. Thank you so much for watching. I'll see you in the next video, where we'll be discussing another crucial health topic for seniors. Until then, stay healthy, stay informed, and take good care of that precious spine of yours.